helping people access the services that are needed, so people learn what cancer is and know when something's wrong and make the doctor's appointments, and then they get the diagnosis.
I'm working to support health providers understanding the Mental Capacity Act, to help people understand what informed and meaningful consent is and how to work with people that perhaps need a little bit more help.
When we come across these individuals with learning disabilities, we have a bit of a network, but it's trying to implement that. We've probably only come across it once or twice at the moment, and hopefully make the processes a lot smoother, because at the minute it is a bit clunky. We need to experience it more to be able to understand how to provide a better service for these individuals.
Because I live in Elsick, and I'm always thinking about people with learning disabilities, men and women, and I can get the word out. But that's just in one area. I can't do it for the whole of Newcastle.
We need to be able to get the messages out about the screening in a way that's accessible for people, so that they can make a decision on whether they choose to have the screening, but they need to be simplified so that they can make their decision themselves instead of other people making them on their behalf.
I've been involved in making the letters and information leaflet used in the breast screening programme into easy read, and we're hopefully going to share that with all the screening units across the North East and Cumbria. It's going to be part of the national review of screening and immunisation literature, so that's the focus of that work for 2016-17.
So what I think we should do is a guide about different places where people can go and different services that they can use. I think that was really good. So that's something what we will think about doing, maybe producing something like that, a guide.
Help the member of staff who works in the screen department to moderate the attitudes towards people with learning disabilities.
And support staff don't seem to have the commitment that they to take people right the way through the journey, and maybe even a case of holding their hand when they're actually getting the procedure done. So there needs a lot more education when it comes to the support staff.
Think about how we use personal stories, because I think they are so powerful, because you can't always capture it in data.
What I'd like them to take away is just to have learning disabilities right at the forefront of everything that they do, and to think first before treating everyone. Everybody has different needs, and I think today the patient experiences were the most powerful to help you in practice.
Obviously we've got the bigger piece of work to do in NHS England and Public Health England, which is to find out if what we're doing is actually preventing people from dying of cancer, which is the ultimate outcome.
It's great because it gives us the a good network of all the different people here, people's experiences, and to hear from the people themselves, it's really helpful.
Interesting is about the bowel screening, because we've just been talking to some nurses next door about their job, and it's really interesting to see how they actually do deal with disabled people. It's a lot of disabled people actually do go through with whatever, but it's the carers who don't understand what goes on.
I think it's really important because we're able to raise awareness about the inequalities and pass on information about the progress we've made so far with the cancer screening project.
The benefit I've got out of it specifically is a couple of things to think about for the National Bowel Cancer Screening Easy Read leaflet that I'm sort of partly responsible for. So using the word learning disabilities on the front cover can put some people off. And it'd be quite an easy change just to take those words off and just make it just an easy guide to bowel screening instead.
I think it's really important to bring a lot of people together, and then we can pass things on. There's a couple of ladies who I've spoken to about how they can get the help before the screening's due, because they're worried about things. So as a learning disability nurse, I've jotted them down a few little details and said try that. So
just the fact that we have a network of people who can help us, as well as a network of people who can help the people with learning disabilities, really.
Well, it's really useful for me just to try to steal ideas off people who are doing good stuff locally, because then hopefully, rather than reinventing the wheel nationally, we can just disseminate the good practice out, have national guidance based on the best of what people are doing locally.
The pledge that I've put up today is I do quite a bit of work with the GPs, and I think a simple thing I can do is just remind myself when I'm doing sessions with GPs to raise the awareness of how they record individual best interest decisions on screening of any type. Just ask the question.
So it was to facilitate a cancer screening awareness programme for Jack and Josephine, pop-up sessions that run throughout the year that will give people information to make an informed choice.
We basically just want to make a pledge that we are going to continue networking as much as we can with community teams, Macmillan teams, to develop materials for helping our local screening population, in particular the people with learning disabilities.
It's really great to see some really passionate people doing some really important work. It's obvious that what is being done is making a difference.
I have enjoyed the session very much. It's been really good to hear what other people have been sharing about the work that they've been doing. It's good to get an update of things that I might have known were going on but didn't really know to the full what had been happening in each of the areas.
Fantastic presentations, learning loads of information, and it's really, really rewarding.
Yeah, sure, I think that's been really useful. I think we've met some really nice people and got some very useful information out.
Yes, I've really enjoyed the session what I've been in now. I found it really interesting hearing everyone's points of views.
I'm glad we people like myself from Disabilities got asked to come along, because when there's been events on like this in the past, we would never get asked to come along. Attitudes have changed. I'm actually glad I got to come along.
It's been an absolute great day with all the presentations and stuff, and it's a great place to be.
Audio clicks. Be heard.